Now we are in a new era of medicine. We're looking at what we call personal cell therapy. Before we ever invented medicine, we had our own cells. They either kept us alive or they didn't. So it turns out your adipose fat tissue is loaded with stem cells.
Right under our skin, there's this huge quantity of cells that can actually heal you and promote healing, treat things that we never thought could be treated, and change the way we approach medicine. It's a giant paradigm shift. This, like any science, has to be data-driven.
So in your database, I mean, how many different cases have you collected? How much information is in there?
Well, there's over 9,000 patients enrolled, and when a patient gets enrolled, every 3 months they get an email asking them how they're doing, if they had any adverse events. Patients are followed up for a 5-year period. So all of the information in our database is direct patient feedback without influence, for better or worse.
There's not a drug on the planet as safe as your own personal cells. There's not a drug on the market that doesn't have the risk of death or some weird side effects. If I can take this group of cells and fix the person most of the time, why wouldn't you want to do that? Unfortunately, our partners at the FDA consider it a drug. Why would I have to turn it into a drug? I can't own it.
This must be kind of threatening for the drug companies.
It is. What makes a good product that is monetizable is, when you can take cells and put them in 100,000 bottles and sell them all over the world. Right. That's a business. Someone comes into your office, gets a treatment on themselves that day using their body. That's not a business model.
Now, let's say the government cracks down and says no more stem cell therapies in the United States.
We're going to have tens of thousands of people going offshore to get medical care, which is detrimental for our country.
Should the FDA impose regulations on stem cell clinics in the United States? I expect you will see a huge migration of patients. Are you guys prepared for this? Is this something that you anticipate?
What we are hoping is that the patient have the resources and the possibility to receive this kind of procedure. If it's here, if it's there, it makes no difference, because at the end, the one who's gonna get the benefit is the patient.
The patient is what is important here. It's not the doctor, it's not who reports and who is more smart and who, no. It's the patient. And this is not a pharmaceutical treatment, it's a biological treatment. It's a different, but they come not only to Tijuana, they go everywhere.
Right.
And the India, Pakistan, Korea, Costa Rica, there's several places.
Yeah, in the worst case scenario, people are going to go abroad. They'll go to the Dominican Republic. Japan has set up a registry. China just came out and said they're limiting where you could use it to very large hospitals.
We continue to see clinicians who are the guys in the trenches using the cells creatively to fix things that it's hard for people in academia or in labs or in pharma. It's hard for them to imagine what those needs are because they're not really in the trenches dealing with sick people.
If you do for the society with a clean heart, with truthfulness, you are going to be supported. Nobody can stop this science. We are made of stem cell. Who can say I'm not a stem cell? Tell me. Nobody.
We all should have access to the best healthcare. See, our vision is to make this most advanced science available to the masses. So for India, we are developing stem cell transplant program for almost 155 million people in 4 different states.
I don't think I heard you correctly.
155 million people.
Million?
Yes.
How are you going to do that? I mean, that's staggering.
That's where the government comes in place, because where you have government finances behind you, government regulatory machinery behind you, you can do it faster. We are going to create a tremendous clinical data that has never been created ever before by any pharmaceutical company or any country. And that data will unfold many possibilities and allow many diseases to be treated faster, easier, and cheaper.
These are your own cells. They can primarily heal you, and yet the FDA is treating us like we're doing something diabolical. We're trying to protect the patient. And our goal as a doctor is to actually make people better.
He injected 1 cc of the stromal vascular fraction. A day and a half later, that pain that was going down my leg that I'd had for 2 months, the leg pain was totally gone. That was 2 years ago, last December, and knock on wood, it won't come back.
Stem cell makes the entire body. But what is the body? Body is the combination of the organs. It means this stem cell is making every single organs. We were studying in the medical school, you cannot repair brain, okay? If the brain cells are damaged, it cannot be repaired. So I thought, okay, is it possible to use a stem cell to repair the damaged brain or not? So I designed a very simple experiment. I just made this green fluorescent cell and injected other part of the brain. After 1 week, I see, oh my God, a lot of green. And all these green cells are traveling towards the damaged portion of the brain.
Wow.
That was the best feeling I can tell you entire my life till today. And this was in 2003 and 4 I'm talking. When I checked after 2 months, I see these cells are surrounding the damaged portion of the brain, but all unwanted cells are gone. So that was the best thing I can tell you. And that was the first report in the world to say that yes, if the brain is damaged, a stem cell may repair those damaged brain.
Once you start doing this, it can really almost take over your life. And you can never just go back and say, that's fine, I'm gonna go back to my old life. I'll do surgeries, and I'll write prescriptions, and I'm good. I can never do that again. It's like I've already seen the other side.
What procedures, what kind of conditions that are being treated that you're the most excited about?
All of them. All of them get benefit. There is no just one to mention. Parkinson's, MS. We have other metabolic conditions like diabetic condition that the patient is possible to improve their condition. Rheumatoid arthritis, a lot of benefit with the stem cells.
Let me talk about my first patient I treat with a heart problem. There was a man who lives on New York. He don't go out from his apartment. He cannot move because he feels too tired, he cannot breathe well. The only solution to him was a heart transplant, and the age doesn't allow to transplant. There are no in the program. And we put the stem cells on him. He go. 3 months later, he sent us a picture on the Central Park in New York, and he tells us, now I walk, my breathing is much better, and I'm feeling very well.
So in my local hometown paper, there was an article recently about a 3-year-old girl with leukemia. And she was treated with a new Novartis drug, CAR T.
Right?
And she's showing great improvement. It's something like $500,000
That's right.
a dose.
I can do it for $5,000. That's the answer. My heart's desire is to make it free for everybody. Why should we differentiate between the one who can pay and one who cannot pay? We're all human.
When you see a patient coming back after 6 months and he wasn't able to walk, or he's on a cane or without a cane, and it's very gratifying when a father calls you and say, you know, my kid with autism, well, he's doing great. Now he's going to school. Now he's mingling with all their friends.
Our goal as clinicians is not to have to see the patient again another time. We want you to get better and go home and go on with your life. And we're blown away by how exciting it is to actually be able to fix things that were unfixable.
We're thinking that in the future, we want to have the ability to cure patients. Imagine a diabetic patient that it is cured and he doesn't have to take medication for the rest of the life, then people who produce medication must be worried about it.
Take multiple sclerosis or type 1 diabetes or ALS. All these things are related to the blood problem. If you can change with the correct stem cells, then there is no problem. The person can come out from this disease.
There's no stopping to it. The cat is out. You know, there's no way you're going to stop it or reverse it. This is the way, and this is the most natural way of treating your body. We are part of creating history.
So where do you see the future of stem cell therapies in the next 5 years?
Majority of illnesses will be treated with stem cell in next 5 years. Majority.
What about really degenerative things like Alzheimer's?
All kind of degenerative diseases, neurodegenerative diseases will have a lot of possibility of treatments with stem cells.
It's a global effect that it's raised our quality and helped us offer treatments to the right patients for the right conditions. We're surprised on a weekly basis, if not daily basis, because there are things that we just never imagined would respond. We have that body of knowledge, we have this technology, that needs to remain in the hands of physicians.
If you're really interested in protecting as consumers, quit telling people what we're doing is dangerous when we have over 9,000 patients and virtually no danger. We are a disruptive technology. When push comes to shove, we can treat a lot of people pretty inexpensively. What's going to happen eventually is every newborn is going to bank their cells, so you'll have your own cells banked.
Our data is quality and accurate and depicts what's really going on with people clinically and subjectively and honestly. We can use that to educate people and educate doctors and educate regulators. We have something that we can use to help everyone in the country have access to safe regenerative therapy. And it's basically going to come down to just pure data.
And that's just going to be patient outcomes.
Exactly.